I guess the question is, should we be focusing our issues more on trying to keep drugs out of the hands of people in the first place, making sure that doctors only prescribe them where necessary, or and trying to educate people about safeguarding, this is this painkiller is for you and it's for a reason and for no other reason. Except I suppose it's seductive as to the value when they finally realize what they have, what they pay for and what it is on the street. It's probably a difficult proposition, but should we focus our efforts on that, emptying out the medicine chest and locking, or just on the education, telling young people what the problems are?
I think they're all equally as important.
They are.
I don't think you can back away from either of those two issues. I think you need to have the education piece of it, and you also you do need to lock up you can't have the medicine cabinet. You can't have your Percocet in the bathroom behind the mirror anymore, because you might forget that it's there. Your dentist prescribed it 6 months ago for oral surgery. You might think you're a parent who's on it, and you count your beers before you walk out, and you lock your liquor cabinet, but that Percocet's sitting there, and your kid knows it's there.
And no one counts the pills.
And nobody's counting.
Right.
So you have to, parents might not think that way until somebody points it out. And then you go, oh yeah, go home and look.
They tell you not to throw them down
not in the toilet anymore. No.
And so how does someone, safely get rid of, some of the painkillers or other medication they have? What is Weymouth?
There are a number of ways. We get calls all the time about it. In Weymouth, we have household hazardous waste collection days where we've added a medication collection component so people can bring medications twice a year. I know that there's National Drug Take-Back Days that we've also participated in, and I believe there's one coming up in the spring. I believe it's in April. So people should be looking out in local newspapers and radio and to determine when those dates are. But people, if you have medicine in your cabinets that's unwanted, unused, expired, anything like that, you really, it's a great idea to get rid of it right away. If you don't need it, get rid of it right away. With a lot of medications, you should dilute them in water and then mix something like kitty litter or dirt or something, put it back in its original container, tape it shut, and stick it out with the regular trash is usually what is recommended.
If you suspect someone has a problem with opiate usage, then you must have to perform some kind of evaluation on the person as to how deep the problem is. And so there must be different levels of early treatment intervention. I mean, how do you determine whether the person just is, just getting into the infancy or has really had a long time problem? How do you figure that out?
Well, I think there's a progression especially with pills. I mean, some kids are using their Percocets, like you say, that might have been left over from oral surgery, and they're moving on to OxyContin, and OxyContin's expensive, so that you might find that there's money taken from your home or jewelry or stuff, because a lot of times kids will sell those kinds of, take money from their parents, take tangibles and sell them for money to support their habit. And then when they go on to heroin today does come in this part of the country in a snortable form. So so what eventually
so you're not going to see track marks.
You might not see track marks right away, but eventually that's a sign.
How do you tell, though, whether the person is as to the range of the addiction, as in if it's in the infancy, or whether or not they've been using for 3, 6 months, or a year? Is there any way for anyone to evaluate I know you said that you would progress up the chain a little bit. How can you tell if you now decide a child has a problem and you want to get them help? How do you determine how bad the problem is? Is there such a thing as, the problem is bad no matter how?
I think the problem is bad no matter what.
Right. Day one, that's
it's an issue. Because like Dr. Kelly said, there is that euphoric effect that people are always chasing. So it is
and I think it's easier to identify people with the more severe problems, and as these guys are saying, it's harder to it's more important to catch it earlier, and this is where it becomes.
Well, I guess that's my question. How do you
Yeah.
identify the earlier user? And after you figure you have a problem, how do you?
I mean, from an evaluation standpoint, in a clinical setting, there are standardized measures that you can actually use, interview tools and standardized assessments that you can use to gauge the degree of severity of addiction.
Okay, so
You can that way it gives you a clue as to how much their brain essentially has changed and taken over their life, how much the drug has taken over their life. So there are measures, ways of doing that. If you're talking about it from a kind of a community perspective, in terms of, if you're just out there as a parent or a loved one of somebody who you think may be using, that's kind of harder because, like you said earlier, Mike, is that they may be able to hide it quite well for quite a while until they can't hide it anymore. And by that point, when it starts to get above the horizon there, it's already a bad problem, and it's very difficult for them to stop.
if people needed to know, just you said there was internet sites that people can go to, and then Weymouth has like the mayor's office, you have the drug task force, you have resources that you would give to parents.
Absolutely.
And most of the school nurses have been through training here. We also have a school collaborative as well.
Absolutely. Yeah, I think the nurse in every school, regardless of age or grade level, is a resource to the parent, and sometimes that gets overlooked. If you establish a relationship with the student, you can do the same thing with a parent, and parents have to know they can reach out to us at any time. We're with your students 5 days a week, 6 hours a day, every day. Call us.
Teachers as well.
Yeah, absolutely.
Now, in detox, there are local facilities where people can get assistance as well. Insurance covers sometimes covers a lot of help and assistance.
I think one of the first things that I would recommend is, as for someone who's a parent or someone who's using, is to contact the support group Learn to Cope. Joanne Peterson has a wonderful. She's been through it. She has a wonderful network, and you need to get yourself help in order to help your child. And her website has a wealth of information on how to access treatment, what kind of treatment programs work.
So we have Nancy Haller and others here in Quincy have a good group of parents that are getting together, and Learn to Cope is kind of interesting because it kind of sprang out of the need of a parent. It was not really started with the intent of where it has gone. It just kind of has mushroomed to the point where it has become such a valuable resource. And that's, I guess, what we were trying to leave people with initially, is that we have a problem, and we should start to recognize that is the first thing. And the second thing is there are plenty of community resources out there. But that I'm surprised to learn when you said 16 states, it's the leading cause of death is somewhat, it's worse than, that hopefully will sink into people and that fight. So there's some great community police officers that we rely upon, and I hope I'm one of those people who said I'd rather deal with prevention and intervention than prosecution. That's the last thing I want to do, and I hope that we will have a compassionate officer who will work with people that have problems. But if you're out there adding to the problems by selling drugs, you probably won't like me. And I know that different reasons why people do sell drugs, but it just, I think with professionals like you, Dr. Kelly, we hope to continue to train people. I wanted to briefly thank you all for your brief participation tonight, and if you can continue to pass the word that obviously there are community resources out there. I'm trying to impart that on some of the people that I'm hiring, that this should be job one. And even the attorneys that are working for me to have the appropriate compassion for people who are having a problem, and families dealing with a problem, but to be firm when you find the person who is really deserves to have the full force and effect of the law brought to bear. But and to Lynn, the mayor, has been a great friend, and I know that she's one of the more caring people I've had to work with. And sorry to say, Kristen, you have to put up with. I have I think one more relative at North Quincy High School that she's a junior, so you have to put up with her. That's the last of the Morrisseys or Reardons that are there. So my sister teaches in the school system, and I hear from her too as well how difficult it is. But I just. Hopefully, again, this brief discussion is something that serves people well. It's a part of a community service by all of us to spread the word to people in Norfolk County, and I'd like to thank you all for listening.